Hey everyone, it's Sharon. Today we're going to be talking about a difficult topic, stillbirth. A stillbirth is any fetal loss after 20 weeks of pregnancy. Stillbirth is more common than you may think, and it's something that many expecting parents worry about. The term stillbirth refers to a fetal death that occurs during or after week 20 of pregnancy, also known as gestation. If loss occurs before week 20 of pregnancy, it's called a miscarriage. While specific definitions of stillbirth can vary from country to country, most fall within these guidelines that refer to the age of the fetus and the length of pregnancy. Early stillbirth is a loss that occurs between 20 to 27 weeks of gestation. Late stillbirth is a loss that occurs between 28 to 36 weeks of gestation. And term stillbirth is a loss that occurs after 37 weeks of gestation. In this video, we'll be discussing the causes, risks, and recovery associated with stillbirth. It's important to remember that this video is for informational purposes only and does not constitute medical advice. If you have any concerns about your pregnancy, please consult with your doctor. The placenta is the lifeline between a mother and her developing baby. It's the organ that attaches to the wall of the uterus and delivers oxygen and nutrients to the baby through the umbilical cord. When something goes wrong with the placenta, it can have serious consequences for the baby's health and development. One of the most common placenta problems is placental insufficiency, which occurs when the placenta can't deliver enough oxygen and nutrients to the baby. This can be caused by a number of factors, including high blood pressure, diabetes, and smoking. Another serious placenta problem is placental abruption, which occurs when the placenta separates from the uterine wall before delivery. This can cause severe bleeding and can be life-threatening for both the mother and the baby. Other placenta problems include placenta previa, which occurs when the placenta covers the cervix, and vasa previa, which occurs when blood vessels from the umbilical cord are exposed. These conditions can also cause serious complications during pregnancy and delivery. It's important for expecting mothers to be aware of the signs and symptoms of placenta problems, which can include vaginal bleeding, abdominal pain, and decreased fetal movement. If you experience any of these symptoms, it's important to contact your doctor immediately. Sometimes, stillbirth can be caused by factors that are beyond our control. Genetic, structural, and developmental conditions can all play a role in fetal loss. These conditions can range from chromosomal abnormalities to birth defects to problems with the baby's organs. Genetic conditions are present at conception and can be inherited from one or both parents. These conditions can affect the baby's development in a variety of ways, and some genetic conditions are incompatible with life. Structural conditions are problems with the baby's physical structure, such as heart defects, neural tube defects, or cleft palate. These conditions can occur during pregnancy due to a variety of factors, including exposure to certain medications or toxins. Developmental conditions are problems with the baby's growth and development that occur during pregnancy. These conditions can be caused by a variety of factors, including exposure to certain infections, maternal health problems, or problems with the placenta. While some developmental conditions can be treated, others can lead to serious health problems or even death. It's important to remember that not all genetic, structural, and developmental conditions will result in stillbirth. Many babies with these conditions are born healthy, and others can be successfully treated after birth. However, these conditions are a leading cause of stillbirth, and it's important for expecting parents to be aware of the risks. Infections during pregnancy can be dangerous for both the mother and the developing baby. Some infections can cross the placenta and infect the baby, leading to serious health problems or even death. Infections are a more common cause of stillbirth earlier in pregnancy, before 24 weeks. One of the most common infections that can cause stillbirth is cytomegalovirus, or CMV. CMV is a common virus that can cause mild flu-like symptoms in adults, but it can be very dangerous for unborn babies. If a pregnant woman contracts CMV, the virus can cross the placenta and infect the baby, leading to hearing loss, vision problems, intellectual disabilities, and even death. Another infection that can cause stillbirth is listeriosis. Listeriosis is a foodborne illness that is caused by bacteria called Listeria monocytogenes. Pregnant women are more susceptible to listeriosis, and the infection can be passed to the baby through the placenta. Listeriosis can cause miscarriage, stillbirth, or premature birth. Other infections that can cause stillbirth include syphilis, toxoplasmosis, and rubella. These infections can all be prevented with proper hygiene, vaccination, and prenatal care. It's important for pregnant women to be aware of the risks of infection and to take steps to protect themselves and their babies. Chapter 4. Umbilical cord problems. The umbilical cord is the baby's lifeline, connecting the baby to the placenta and providing oxygen and nutrients. Unfortunately, problems with the umbilical cord can occur, and these problems can be life-threatening for the baby. Umbilical cord problems are more likely to happen at term or during labor and delivery. One of the most common umbilical cord problems is a nuchal cord, which occurs when the umbilical cord wraps around the baby's neck. While a nuchal cord can sometimes be harmless, it can also restrict blood flow to the baby, leading to oxygen deprivation. Another umbilical cord problem is a true knot, which occurs when the umbilical cord becomes knotted. True knots are rare, but they can be dangerous because they can tighten during labor and delivery, cutting off the baby's oxygen supply. Umbilical cord compression can also occur during labor and delivery, especially if the baby is in a breech position or if the labor is prolonged. Compression of the umbilical cord can restrict blood flow to the baby, leading to oxygen deprivation. In some cases, the umbilical cord may even prolapse, which means that it comes out of the cervix before the baby. Umbilical cord prolapse is a medical emergency and requires immediate attention. While umbilical cord problems can be frightening, it's important to remember that most babies are born healthy. However, it's important for expecting mothers to be aware of the risks of umbilical cord problems and to seek medical attention immediately if they experience any problems during pregnancy or labor. Chapter 5. Maternal Health. A mother's health plays a crucial role in the well-being of her developing baby. Certain health conditions and complications during pregnancy can increase the risk of stillbirth. It's essential for expectant mothers to prioritize their health and seek regular prenatal care to manage any underlying conditions. Conditions like preeclampsia, characterized by high blood pressure and protein in the urine, can restrict blood flow to the placenta and impact the baby's growth. Gestational diabetes, where the mother develops high blood sugar during pregnancy, can also lead to complications. Autoimmune diseases such as lupus and antiphospholipid syndrome can affect the placenta's function and increase the risk of blood clots, potentially harming the baby. Chronic illnesses like diabetes, kidney disease, and heart disease require careful management during pregnancy to minimize risks. Infections during pregnancy, even seemingly minor ones, can pose a threat to the baby's health and, in some cases, lead to stillbirth. It's crucial for expectant mothers to maintain good hygiene, get vaccinated against preventable diseases, and seek prompt medical attention if they suspect an infection. Chapter 6. Unexplained Stillbirth. In almost 60% of stillbirths, a definitive cause remains elusive. This lack of a clear explanation can be incredibly difficult for parents to process, often leading to feelings of guilt, anger, and helplessness. It's crucial to understand that unexplained stillbirths are not anyone's fault. Despite advances in medical science, there are still many unknowns when it comes to pregnancy and fetal development. Sometimes, despite the best efforts of healthcare providers and expectant parents, a stillbirth occurs without a clear reason. This can be incredibly frustrating and heartbreaking for families who are left searching for answers. It's important to remember that you are not alone if you've experienced an unexplained stillbirth. Many support groups and resources are available to help families cope with the emotional and psychological toll of this type of loss. Talking to a therapist or counselor who specializes in pregnancy loss can provide a safe and supportive space to process your grief. While it may be tempting to blame yourself or your body for an unexplained stillbirth, it's essential to understand that these events are often beyond anyone's control. It's crucial to focus on healing and seeking support during this difficult time. Losing a baby to stillbirth is a devastating experience that can leave lasting emotional scars. It's important to remember that you don't have to go through this alone. Reach out to your loved ones for support, and don't hesitate to seek professional help from therapists or support groups specializing in pregnancy loss. Remember to be kind to yourself during this difficult time, and allow yourself to grieve at your own pace. Keep safe, my dear mama. Remember to like and subscribe for more videos.